So we're talking about skin cancer?
Yes.
Do you see a lot of it in your practice?
Unfortunately, I'm seeing more and more skin cancer in my practice, and the good news is, though, I have patients who really participate in their skin care, and so when they see something new or changing, they come in and show me, and we're finding skin cancers very early, having minimal scars, and really great results.
Right. And when skin cancer is caught early, what's the treatment rate and the survival rate?
Well, it's greater than 95% cure rate when caught early, but the really sad news is that people are dying of skin cancer every day. About 20 people die of melanoma in the U.S. every day, and there's just no need for that because it's on your skin, and your skin is completely visible. So just by coming in for a skin check or pointing out and looking at your own skin and pointing out to your dermatologist anything that you think is new or changing, it can be the difference between life or death, and there's no poking, no prodding, just a good light, a magnifier, and an experience of the doctor.
That's great. So are your patients surprised when they come in? What are their reactions when you tell them that they have a skin cancer?
Well, what I try to do is I try to prepare them ahead of time. So when I do a biopsy, I sort of review with them what the differential is, what I'm thinking that it might be. Because there's really two types of skin cancer that we really worry about. One is the melanoma skin cancer, and that is the most concerning because it is potentially deadly in a relatively short period of time. But then there's the non-melanoma skin cancers, which are basal cell and squamous cell. And fortunately, those are so much more common. They're slow growing. They tend to stay local. So when I look at the particular spot that I'm about to biopsy, I can help guide them. I can help guide and sort of determine whether or not it's in the melanoma or non-melanoma, and we can have a discussion about what it means when I get the results back. I always call the patient myself to review as well. So skin cancer is the most common cause of cancer death for women 25 to 29 years old. And the difference is really just coming in for a skin check, looking at your own skin regularly, and showing your dermatologist if you have anything new or changing. And it's really important for patients to understand that it's not only where the sun shines. So you have to look from scalp to between the toes and every single part of your skin in between to make sure that there's no skin cancer there. We know that sun exposure really increases the risk in a very dramatic way. However, it's not only sun exposure.
Great. Well, tell me about the different kinds. I know there's melanoma, non-melanoma. Can you walk us through that?
There's three basic types of skin cancer that we look for when we're talking about sun exposure and the most common types of skin cancer. The first type is called basal cell carcinoma. It is the most common type of cancer, period. It is very slow growing. It tends to occur mostly in sun-exposed areas. It grows slowly and it tends to stay local, which is a really good sign. What it looks like, in our own lingo, we call it a pearly papule. So it looks kind of translucent, may have rolled borders, and a little bit of a depression in the middle. If you scrape it or cut it, you may notice that there's a little bit of crusting in the middle. It may bleed easily, and it may get a little bit, the crusting may heal slowly, but the bump will never go away. So if you see a bump like that, it also sometimes has little broken blood vessels within it. So that's a classic basal cell carcinoma. And again, it tends to occur in sun-exposed areas, but not only in sun-exposed areas. So you need to watch out.
Okay. What are the other types?
There's also squamous cell carcinoma. That's the second most common type, and there are about 225,000 of those expected in the U.S. in a year. So that's a very common type of skin cancer. Again, it's slow growing. It tends to stay local. If you see something that looks like a cut or a sore in the skin that's a little bit crusted, that may, again, bleed a little bit easily, but doesn't ever completely go away, that's a sign of either a pre-squamous cell called an actinic keratosis or even a squamous cell carcinoma. We look for, what I tell my patients is that common things being common, you can have a bump or a cut, but it should heal within 1 or 2 weeks. If something doesn't heal within 1, 2, 3 weeks, then it's time to come in and show me. And then I can help determine whether we need to use a cream to treat it or if a biopsy is necessary to give us a name for it. And it's much better to have a little scar and deal with that, which really is minor, than to have a skin cancer.
Tell us about actinic keratosis. What does that look like?
Actinic keratosis is something you can almost feel more than you can see. It's a little red, rough bump. And one way when I do my skin exam is I also feel the skin as I go to look for any rough bumps. And I tell my patients that when they evaluate their own skin, skin, which they should do every month. Women, when they do their breast exams, should also look in the mirror at their skin and try to do their skin exam at the same time. It's also good when you're washing your face or exfoliating to do your skin exam. But if you feel a rough spot, that's a sign of potentially a precancer or an actinic keratosis.
Very good. And then briefly about melanoma.
And then there's the melanomas. Those are our worst nightmares, dermatologists, because those are potentially deadly, and we are so happy when we catch them early. So we're really grateful when our patients come in and show us things that they think are changing. What melanomas are, they are typically brown, although they don't have to be. So we look at our moles and we look at our brown spots for that reason. Melanomas don't always arise in pre-existing moles. Sometimes they can arise anew in the skin. So if you see anything new, that's also something potentially you should show your dermatologist. But when we think of melanoma, we have the A, B, C, and D. Okay? A is for asymmetry. So if it's different on one side versus the other, that's a warning sign that it could be potentially a pre-melanoma or a melanoma. Pre-melanomas are called dysplastic nevi. That's just the word that we use. So they're not cancers, but they have potential. So A is for asymmetry. B is for border irregularity. So if you notice that the edges are jagged or it fades out at the edges, that's a sign that it needs to be evaluated further. C is color change. So color, meaning variations in color, or change as in a mole that's always looked one way. If you think about it, as an adult, we're fully grown and our skin is fully evolved, so our moles really don't need to be changing. So if you have a mole that's always been the same and now it looks different, that's a sign that you need to show your dermatologist. That's A, B, C, and now D is for diameter. Diameter greater than a pencil eraser head. Now, a lot of my patients come in and they show me moles that are raised, and they're very worried about anything that's raised. I keep telling them, R is not in A, B, C, D. So raised by itself is not an issue. If you have a mole that's always been flat, and now all of a sudden it's raised in some areas and flat in some areas, that's a different story. But a mole that starts out raised, that's always been raised, is not necessarily something that you need to worry about.
Have you had patients who were just completely shocked that they could be at risk?
You know, I've had patients who come in, they think they're coming in for an acne visit, and they're wondering, why am I getting acne at my age? I'm in my 20s. And it turns out that they have basal cell and squamous cell. And the problem is that at a young age, you really feel immortal. So you think that, oh, all those things are down the road. I can do what I like, and son, it doesn't matter. That's for another generation. I have time. But when they find that they have a skin cancer, the one thing that's really interesting is at first they're shocked and they're very upset and they're worried about the scar, which is all reasonable, and we take care of everything for them. But what I find is that those patients are my best advocates. They will go out and they will tell all their friends, and they have really great impact. I had a girl who was 19 years old, and she had a mole on her neck, and I could see that it had all the markings of a potential melanoma, and I didn't actually want her to leave my office, but she had to ask her mom, so she said she'd come back in a week, and I took her phone number to make sure I could reach her. Well, she was good. She did come back, and it was a melanoma. She comes in every 3 months for her visit, but she is from Florida originally, and she goes to her school now, and she speaks about it. And she is very, very good about being a really great advocate, and she's probably saved lives now. So from those few hard stories, there are really great stories that come out of it.
Right, advocacy is so important. Just getting the word out there so people know what to look for.
And when I see people lying by the pool tanning and they look like lobsters or they have spots on them, it's really difficult for me as a physician when I see that it's the single most important thing you do to protect against skin cancer is sun protection. And it's not just about applying sunscreen, it's about reapplying it. So I see young people going out, they don't use sunscreen, or they say, well, it wasn't sunny that day. It's not about sun, it's about daylight. So they just don't apply sunscreen, they get recurrent sunburns, and then over time, some of them develop skin cancers. And at that point, they get it and they feel badly. But my goal is to get them to get it earlier before the skin cancers happen, because we can prevent it. And sun exposure or sun prevention is really critical in helping prevent skin cancer. And you know, you get your vitamin D from a pill. That's a safe way to get vitamin D. And there's a lot of stories about how important vitamin D is, but and young people use it as an excuse. So it's really not a good excuse. Vitamin D in a pill is just as effective as what you get from the sun, and it's much, much safer.